Hey guys, welcome back to Confessions of a Doctorholic. It's me, Dr. Slayman, or Hafsa. And today's episode is a wild one. We're diving into that awkward space where medicine meets personality. Oversharing gets way too real, and the internet once again proves it has a fetish for everything. Let's talk about stomas, difficult patients, and the weirdest thing I learned this week. So let me just start by saying this. Yes, I know it sounds awful to say a patient is annoying, but if you're in medicine, or honestly in any service job, you know that some people are just a lot. And on my list right now, we have someone who checks every one of those boxes. She's recovering from a really bad bout of diverticulitis, had to go for emergency surgery, and she now has a temporary stoma. She's young and understandably she's upset, but she's also, let's just say, very expressive. Tears, drama, constant back and forth about how she's doing. You ask her about her pain and it's unbearable, I can't stand it. But then she's like, it's not worse than yesterday, just really upsetting. And she's also able to sleep at night, which is my telltale sign of if you can sleep, you're not in that much pain. So yeah, it's a ride. Now, where things got interesting was when she started opening up about the Stoma Bag and how it was affecting her self-image and dating life. My senior, who's actually interested in going into colorectal surgery, was super sweet about it. She's fascinated by stomas. So her vibe is all like, it's completely manageable, it's temporary, and you'll be okay. She tells the patient, if someone can't love you with a stoma, they weren't worth it anyway. Which, fair point, solid advice. But then she adds, also, some people are into it. It's a fetish. And I just stood there processing. So the patient clearly, very online, goes, yeah, I've been looking into the site called ostodating.com. At this point, I'm half listening, half Googling in my mind, half horrified that this is even a conversation I'm having during morning rounds. I mean, ostodating? Not Hinge, not Bumble, not Coffee Meets Bagel. ostodating.com. And she was serious. I didn't stick around long enough to figure out if this was actually a thing. But later, in true oversharing fashion, one of my friends tells me, oh yeah, it's a real fetish. It's called the Philly side pocket. Excuse me, what? The Philly side pocket. I don't even know where to begin. Is it from Philadelphia? Is it a side pocket of anatomy? Is it a position, a slang term, a surgical invention gone rogue? I honestly don't want to know, but also I kind of do. And here's the thing. This isn't about making fun of people with medical devices or condition. It's about the human mind, especially when mixed with the internet, can take literally any medical situation and turn it into something unexpected, weird, or even marketable. Like, I'm all for body positivity and confidence, but I wasn't ready for fetish energy during rounds. That was the plot twist no one warned me about in med school. So fun fact, I went to a party, I reckon it was like 2 weeks down the line, home party. One of the dermatology fellows rocked up and we were talking about this. He was like, oh, as a surgery resident, what's the weirdest thing you've heard about? And this immediately popped to my mind. I was like, oh, this thing exists. So full disclosure, I didn't Google it. I didn't want to use the hospital phone or the internet or any of that. And I still felt like it was a TMI moment. He Googled it. He was fascinated. I almost feel like he's going to try that at home. So, ladies and gentlemen, today's confession. One stoma, one dating site, and one traumatized resident just trying to do her job. Thanks for tuning in to Confessions of a Doctorholic. Until next time, stay curious, stay professional, and maybe skip the P's and avoid any mention of side pockets unless you're folding laundry.